Welcome viewers to the Nursing 449 Group 2 Community Project teaching video. Together we'll be discussing information on diabetes. I'm your first host, Tegan Shaw, and I will be talking to you about the problem that is diabetes, what diabetes is, and national goals made to improve the condition that is diabetes among Americans. So why should you learn about diabetes? Diabetes affects nearly 29.1 million people in the United States, according to the Office of Disease Prevention and Health Promotion. This is only an educated estimate. The true numbers of diabetes are unknown, as an estimated 25% of diabetics do not actually know that they have diabetes, and because of this, they live undocumented as diabetics. This large number of diabetics is also very costly to our health system and government. In the year 2012 alone, financial costs of diabetes due to healthcare needs, disability, and death cost $245 billion. You may have been invited to participate in watching this video because you have a potential risk for developing diabetes, but whom are exactly at a higher risk than others. Those at a higher risk of developing diabetes include African Americans, Hispanics, American Indians, Native Hawaiians, and Asian Americans. Minority populations are also at a higher risk of developing diabetes. Those with family histories of diabetes are also at a higher risk of developing it. Ultimately, everyone has a potential risk for developing diabetes and may benefit from the teaching in this video. What exactly is diabetes? Diabetes can be broken down into three major types, but many forms of it exists. The first type we will be discussing is type 1. In type 1 diabetes, the pancreas, an abdominal organ, does not produce enough insulin. This form of diabetes is most commonly discovered in children and young adults. It can, however, be discovered at any age. Signs and symptoms that may lead to the discovery of type 1 diabetes is excessive thirst, urinating frequently, fatigue, unexplained weight loss, sores that do not heal normally, and blurry vision. This insulin that is not produced is a hormone that carries glucose, a sugar, into the cells of the body for use. This inability for glucose to be transferred into cells creates high levels of glucose in the blood. This can be tested for by sampling an individual's blood glucose level. Another test, called the A1C test, shows an approximated average blood sugar level over the last 3 months of an individual. Both can be completed in a hospital lab. Normal levels of the A1C test are less than 5.7%. Any percentage higher may indicate that you have diabetes or prediabetes. Multiple medical conditions may skew the results from the A1C test, so be sure to talk to your doctor regarding any A1C results. Type 2 diabetes is much more common and will be the focus for both this project and for community prevention. In this form of diabetes, high blood glucose sugar levels are caused from a lack of insulin production in the pancreas or a resistance of the body's cells in using the insulin that is produced. Things that may put you at risk for developing this type of diabetes includes obesity, lack of exercise, or a family history of diabetes. This type usually occurs at a later age than type 1. This type is much more preventable through making changes in diet and lifestyle. Signs and symptoms of diabetes are the same as type 1 and can also be identified through similar testing such as the A1C discussed earlier. Gestational diabetes is the final type we will discuss for the purpose of this teaching video. Gestational diabetes occurs in pregnant women, and it too involves high blood sugar, which is not good for babies. This type commonly resolves after delivering the baby, but it can be a risk factor for developing type 2 diabetes in the mother. This type of diabetes is tested for in the second trimester of pregnancy. If you are concerned for developing this type of diabetes, talk to your health team for further instruction. Diabetes has complications as hinted at in the previous statement in its financial costs. High blood sugar levels over time can lead to kidney damage, nerve damage, and damage to small blood vessels in the feet and eyes. It can also increase an individual's risk for heart disease and stroke. Excessive high or low blood sugar levels can become life-threatening emergencies and can lead to death. Healthy People 2020 is a collaboration of professionals that set scientific-based national health standards and goals every 10 years. The most recent report is from December of 2010 and includes many goals for national diabetes care. These include reducing the number of diabetics in the population, reducing the death rate among people with diabetes, reducing diabetes-caused death, reducing the amount of amputations performed every year in patients with diabetes, improving blood sugar control in individuals with diabetes and subsequent better A1C tests in diabetics, improving lipid or better cholesterol levels in patients with diabetes, better control of blood pressure in diabetics, increasing the amount of dental exams in diabetes, increasing the amount of diabetics who have annual foot and eye exams, increasing the proportion of diabetics who complete A1C tests to twice a year, increasing the proportion of urine testing in diabetics, increasing the amount of diabetes education, increasing the proportion of known diabetics, and increasing prevention measures. For more specifics, please visit healthypeople.gov.
In this section of the presentation, we're going to review programs that are available to the diabetic community. These programs will include local, state, and national levels. The Yuba Sutter Diabetes Resource Center offers educational classes to promote health and wellness within the diabetic community. Their executive director, Oida Wakefield, travels to other businesses or schools to spread awareness, usually in the form of health fairs and presentations. But the program is also available for one-on-one sit-down conversations. They also offer a special support group every month for children with type 1 diabetes that not only provides education and emotional support, but also fun activities. Their fundraising event, Bike Around the Buttes, will be celebrating its 33rd year this 2018. Since it is a not-for-profit organization, all the proceeds go directly towards the programs it offers. There are also local hospitals. The two main hospitals available are Sutter Health and Kaiser Permanente. Sutter Health has a very sophisticated approach to diabetes control. Not only do they have their diabetes specialists and physicians, but they also form their own diabetes council. This allows them to take on a team approach to managing and improving diabetic conditions at any stage of development. They offer telephone support, weight management and fitness programs, online self-help plans, support groups, and advanced specialty cares for those who have extra complications due to their diabetes. At Kaiser Permanente, they have classes and online communities available. However, there are no specific programs offered outside of the treatment they offer within the hospital, although they do provide plenty of information online, so any patient can learn more about their condition and how to improve their outcome. The helpful tips found on their website offer simple and reasonable goals that will aid the patient in obtaining a healthier lifestyle and manage blood glucose levels more effectively. As far as state programs go, the California Department of Public Health has its own branch off called the Chronic Disease Control Branch. One of the areas it focuses on is diabetes. The program receives its funding from two organizations, the Prevention First and the Lifetime of Wellness. That funding goes towards only a select few counties within the state of California, namely Alameda, Fresno, Madera, Merced, Monterey, Sacramento, Shasta, San Joaquin, Solano, and Tulare. The main focus of this state program is to provide prevention of diabetes through education. While these programs have been successful in making their contributions to each community they serve in, there are also a few national programs available that have made a profound impact on the diabetic population in America. The most well-known organization is likely the American Diabetes Association, or the ADA, followed by the National Institute of Diabetes and Digestive and Kidney Disease, otherwise known as the NIH, and the Center for Disease Control, or the CDC. The ADA has an extensive 12-month program that is completely free to use. Upon signing up for this program, they will send 6 informational packets to help learn to live well with diabetes, a monthly e-newsletter with helpful everyday tips, stories of real people with diabetes, 6 free issues of their Diabetes Forecast magazine, and access to their online community and local events. All of their products are also offered in Spanish, which is the second most common language in the United States. Their efforts are mostly focused on type 2 diabetes. The NIH website is full of information about diabetes. Anything and everything that there is to know about diabetes is found on their website. It is very user-friendly and helps the viewer become proficient in their knowledge on how diabetes works, what they can do to live with it, useful statistics about diabetes, what kind of diets to eat, blood work, medications, complications of prolonged uncontrolled blood sugar, other risks associated with diabetes, and so much more. They also fund the National Diabetes Education Program, which works with the local, state, and federal organizations to implement the latest research and evidence-based practice to promote the highest level of diabetic care. While diabetes has been around for a long time and already has a fairly effective treatment plan, the NIH is still investigating new forms of treatment. Their clinical trials are available to the public. By visiting the clinicaltrials.gov website, patients can find a clinical trial that best fits their description and then send in the application electronically. Whether it is a new drug, a different surgical procedure, or simply using the same treatments used today in a different way, it seems that there are many alternatives to approach if any common practice care plans do not seem to be working. The CDC also has many flyers and handouts available that are easy to follow and promote diabetes awareness. A program is available for any provider or caregiver to print out and follow along with their patients. Should they choose to follow the program, it would help them to promote a healthier lifestyle, better control of blood glucose levels, and prevention of development of further complications of diabetes. If there are any pre-diabetics in the community, putting them through this program might be able to prevent it from developing into actual diabetes.
Ethical issues with diabetes. One of the main ethical issues with diabetes is related to its prevention. As we all know, diabetes is a predisposed disease, meaning it's embedded in our genetic makeup. There are 2 types of it, diabetes 1 and diabetes 2. The first type is diagnosed at a young age and it is irreversible. The other type is diabetes 2, which accounts for 90% of all the cases of diabetes. Diabetes happens because our body develops a resistance to respond to insulin, which is produced in the pancreas. Insulin is necessary to metabolize sugar into energy, which is necessary for the proper functioning of our body. Diabetes 2 is predominant in individuals over the age of 30 who are inactive. About 80% of people with diabetes 2 are overweight and lead a sedentary lifestyle. However, it is not exclusively related to people with those characteristics. One of the solutions to the development of diabetes is the gene therapy treatment, which consists in the repairing or mediated genes of our DNA that can cause this disease, which is done through the introduction of new genetic information into our DNA. One of the issues with this type of treatment is the high risk for the patients to develop an autoimmune response, which could lead to complete organ failure. Another ethical issue with this type of treatment is that it doesn't change the attitude of the patient towards his or her physical activity, or lack thereof. The fear is that once the patient is cured, the underlying reason for the disease will remain, and therefore the patient will be at a high risk to develop the disease again. Research has found that the most effective way to lower the risk to develop diabetes is to make lifestyle changes such as routine exercise and proper nutrition. Another controversy of ethical issue related to diabetes is the long-term use of placebo during clinical trials for new medications being developed to fight this disease. There is no problem using placebo for short-term studies. However, to try a new medication, the standard testing can last up to 3 months, which poses a huge problem for diabetic patients receiving the placebo instead of the medication. What would change the situation is the use of proven effective medication versus new medications being developed. Thus, the patient would not be exposed to the risk of being without the proper and needed medication during the trial. It is commonly believed that after 6 months, irreversible microvascular complications can be produced to the hyperglycemia the patient will experience while in placebo. Cultural issues with diabetes. One of the main issues with diabetes in the United States today is the disproportionate amount of growth in people with diabetes among the Hispanic, African American, and Asian American population in relation to the white population. The growth of white people with diabetes remains steady, whereas the number of Hispanics, African Americans, and Asian American people with diabetes has increased dramatically. This issue relates to cultural backgrounds as well as genetical predisposition. One of the ways to prevent this from happening is REACH, an initiative founded by the CDC leading to develop in healthcare providers a culturally sensitive environment when dealing with Hispanics, African Americans, and Asian American patients. This initiative consists in conducting instructional sessions at the provider's office, holding the sessions during staff meeting to ensure that everyone involved is present. It also includes the use of some sort of interactive format, which includes feedback from patients, which also provides additional resources for healthcare providers and their staff. We, as healthcare providers, must be acutely aware of the different beliefs and traditions of susceptible populations such as the Hispanic, African American, and Asian American. It is not enough to just bombard these people with information and statistics. Rather, we need to develop a relationship of trust and understanding, which involves building a better lifestyle based on the latest evidence with the proper regard for their beliefs and cultural traditions. Political issues regarding diabetes. In June 2012, the United States Supreme Court ruled that the state expansion to Medicaid was unconstitutional, and by doing so, left it completely up to each state to choose to expand Medicaid. By January 2014, 24 states had opted not to expand their Medicaid programs. Unfortunately, in those states, eligibility remains very limited, being 50% of the federal poverty level, which is equal to $5,835 for one person per year, and $11,925 for a family of 4 per year. The adults without children within those states are ineligible for assistance. It is calculated that at least 4 million adults in the United States fall into what is called a coverage gap. 54% of those adults are between the ages of 35 and 64. The real issue with this situation relates to the dramatic increase of the price of insulin during the last several years, making it almost impossible for people with limited income to afford the medication. The number of patients in this situation is significant due to the comorbidities associated with diabetes. Among the reasons for the high cost of insulin today is the monopoly held by its manufacturers. These companies set artificially high prices for the insulin in order to manipulate their status within the insurance companies that cover those medications. Bottom line is, the most affected by this situation are the people who need the insulin to survive on a daily basis. Diabetes is a tremendous money-making source, and pharmaceuticals are benefiting the most from that $22 billion per year the United States spends in diabetes medication. This according to a study from September 2017 published by the United States National Library of Medicine. Legal issues. For years, people who have suffered of diabetes have been banned from the workplace or discriminated in one way or another due to how difficult it was to manage the illness during the 70s and 80s and the lack of education regarding the medical advancements by employers. Portable glucometers and easy-to-access medication has made diabetes control attainable, and with it, patients have the opportunity to fully participate and develop in their career of choice. To help promote education, the American Diabetes Association has developed a four-step approach which consists of educate in order to prevent or stop discrimination, negotiate in order to help those who are experiencing discrimination by giving them the means to educate decision makers, and when that doesn't work, the tools to negotiate resolutions or to pursue litigation. Litigate to effect changes in current legislature to promote education, and legislate to change laws that lead to discrimination.
Good afternoon, viewers. My name is Casey Teeter. My goal in this presentation is to help the viewers understand what levels of prevention are, how public health nurses and other medical providers utilize levels of prevention to keep our community healthy, and how levels of prevention can impact you as a learner, especially if you have diabetes or know someone that does. These next few slides will help the learner determine what level of prevention applies to them individually and collectively as a community. It is common practice for the public health nurse and other medical health care providers to utilize levels of prevention to guide their practice with the goal of public health and safety. There are 3 levels of prevention. The first level of prevention focuses on those members of the community that do not exhibit any form of the disease. This would include any signs or symptoms related to disease processes. The secondary level of prevention concentrates on early identification of the disease. The third level of prevention narrows its focus to prevent further disability of the disease process. Level 3 prevention attempts to halt the progression of the disease, reverse it if possible, and treat the disease so the individual can have the best quality of life possible. There are many facets for the first level of prevention, such as activities, including education, health promotion in the form of exercise, and healthy eating. Education by the public health nurse or other health care team member is a major component for the first level of prevention. Education would focus on the prevention of contracting and spreading the disease. One example of this could be educating public on hand washing to prevent the spread of the flu during flu season. This education would occur prior to flu season starting. The effectiveness of the education could be seen in a reduction from the number of cases seen in this current year compared to the number of cases seen last year. This is one example how primary level of prevention can prevent the spread of disease. Education brings awareness of the disease and in this case, diabetes type 2. With awareness, the community can make smarter and healthier lifestyle choices and changes, which can prevent the development of diabetes type 2 in an individual or susceptible members of the community. Promotion of exercise and healthy eating is an important step in the first level of prevention and can dramatically decrease the development of diabetes type 2 in an individual and in the community. Level 2 prevention is focused on early identification of a disease process. Early identification can be achieved through random screenings, such as at a health fair or a yearly checkup with the primary care provider. The focus is to identify these disease processes early, because the earlier the disease is identified, the better the prognosis for the patient. With diabetes type 2, early identification can prevent costly hospitalizations due to complications such as hyperosmolar hyperglycemic non-ketotic syndrome, and can prevent the deterioration and disease processes in vital organs such as heart, kidneys, and eyes. The third level of prevention is aimed at preventing any further disability to the individual caused by the disease. This level of prevention focuses on medical treatment provided to the individual in a hospital or outpatient setting. It may also include any rehabilitation that the patient may need to continue leading a productive life. Public health nurses can be involved in tertiary care by helping patients obtain access to medical facilities, doctor appointments, and follow-up care for compliance of medical regime. Yuba Suter Diabetes Resource Center, located in the Yuba City, California, is involved with primary, secondary, and tertiary levels of prevention. Yuba Suter participates in educational health fairs for the community. These health fairs are free to the public and educate about diabetes prevention. Health fairs also provide screenings and can help identify early stages of diabetes. This is considered secondary level of prevention. Yuba Suter also offers free educational classes to those who are already diagnosed with diabetes. These classes include information about foot care, stress/chronic illness, carb counting, meal planning, A1C testing, physical activity, a guide to better office visits, and healthy holiday eating. These classes focuses on the control and management of diabetes and are considered a tertiary level of prevention. Yuba Suter also encourages exercise. The local hospitals I identified in these slides, Suter Health and Kaiser Permanente, focus on tertiary care. The hospitals offer sophisticated and advanced medical treatment for those that have diabetes. These medical treatments are aimed at reducing the debilitating effects of diabetes. They prevent such things as progressive heart disease, kidney disease, loss of eyesight, and the loss of limb related to amputations linked to diabetic neuropathy. They also offer classes, telephone support, weight management, and exercise programs. The state of California, through the California Department of Health, offers primary level of prevention. This is achieved through specialized funding mentioned above and focuses on the education of the community about prevention of diabetes. National programs identified in these slides include American Diabetes Association, National Institute of Diabetes and Digestive and Kidney Disease, and the Centers for Disease Control. All these programs offer primary, secondary, and tertiary levels of prevention aimed at educating public about diabetes. Education includes basic diabetic knowledge. What is diabetes and how to prevent it? Early signs of diabetes and what to do about it, and how to live with diabetes by managing it. Through implementation of healthy lifestyle changes. If you or anyone you know would like more information regarding these programs, please see the web links below.